Today marks a decisive change in federal nutrition policy, made possible by President Trump's leadership and the work of MAHA moms and public health advocates who demanded reform. Today, in accordance with President Trump's directive, Brooke and I will release the dietary guidelines for Americans 2025 to 2030, the most significant reset of federal nutrition policy in history. These guidelines replace corporate-driven assumptions with common sense goals and gold standard scientific integrity. These new guidelines will revolutionize our nation's food culture and make America healthy again. For decades, Americans have grown sicker while healthcare costs have soared. The reason is clear. The hard truth is that our government has been lying to us to protect corporate profit-taking, telling us that these food-like substances were beneficial to public health. Federal policy promoted and subsidized highly processed foods and refined carbohydrates and turned a blind eye to the disastrous consequences. Today, the lies stop. The new guidelines recognize that whole, nutrient-dense food is the most effective path to better health and lower healthcare costs. Protein and healthy fats are essential and were wrongly discouraged in prior dietary guidelines. We are ending the war on saturated fats. Diets rich in vegetables and fruits reduce disease risk more effectively than many drugs. Whole grains outperform refined carbohydrates. Added sugars, especially sugar-sweetened beverages, drive metabolic disease, and today our government declares war on added sugar. Highly processed foods loaded with additives, added sugar, and excess salt damage health and should be avoided. As Secretary of Health and Human Services, my message is clear: eat real food. Nothing matters more for healthcare outcomes, economic productivity, military readiness, and fiscal stability. The dietary guidelines shape dozens of federal feeding programs, including Head Start. These standards affect 45 million school lunches every day, meals for 1.3 million active duty service members, and food served to 9 million veterans in VA hospitals. Today begins the work of aligning those programs with affordable, whole, nutrient-dense food. Implementation requires coordination across the government. I'm working with many of my fellow cabinet secretaries to deliver results. I want to thank Bobby Mukamala, thank you very much, who is the president of the American Medical Association, for committing to mobilize the medical community on nutrition. And I thank also the American Academy of Pediatrics for partnering on this effort. I also look forward to working with Dr. Jay Bhattacharya and Dr. Marty McCary to fund and prioritize rigorous nutrition research at the NIH and at the FDA. The stakes are measurable and severe. A Johns Hopkins analysis estimates that 48% of every federal taxpayer dollar now goes to healthcare. The CDC reports that 90% of healthcare spending treats chronic disease. That means that 40%, 40 cents of every dollar that taxpayers pay in this country is going to treat diseases that could be averted through good food. The United States has the highest obesity and type 2 diabetes rate in the developed world. We spend 3 times more per capita than the European Union on healthcare, yet our life expectancy is 5 years lower, largely due to diet-related chronic disease. Our childhood obesity rate is 5 times higher than countries like France. 1/3 of U.S. teens have prediabetes, over 35% are overweight or obese, and 20% of young adults have non-alcoholic fatty liver disease. 77% of military-aged Americans are ineligible for military service because of diet-related conditions. If a foreign adversary sought to destroy the health of our children, to cripple our economy, to weaken our national security, There would be no better strategy than to addict us to ultra-processed foods. It's shocking that our own government helped to drive these cataclysmic changes in our diet. The damage is real, it is preventable, and President Trump has ordered it to end. If the United States reduced obesity, type 2 diabetes, heart disease, and Alzheimer's to Japanese levels, we would save approximately $600 billion a year. About 50% of Medicare's projected long-term deficit, or $5,000 per family annually. Current policy worsens the problem. 42 million Americans rely on SNAP, where common purchases include sugary drinks, candy, and chips. 78% of SNAP recipients are enrolled in Medicaid, and 90% of Medicaid spending goes to chronic disease. These incentives raise healthcare costs and undermine health. This must change. A new framework centers on protein and healthy fats, vegetables, fruits, and whole grains. And you can see the food pyramid here. It's upside down, a lot of you will say. But it was actually upside down before, and we just righted it. For the first time, the dietary guidelines directly address ultra-processed foods and set firm sugar limits in federal procurement, driving a significant reduction in added sugar in school meals. I want to thank President Trump for his leadership and the partners committed to ensuring that federal food dollars support real food and better health. Thank you.